Now, coming to the continuation of the previous section, now why this research? In research, what you have studied in research, I need to know that what you have studied in research. I guess that when the students come here for statistics class, they may have covered half of the portion of research. So you may be knowing why we need to do, what's the first step in research? What's the first step in research? You need to have a problem there. Once the problem is there, then what you will look into the research, you will find the population in which you need to do this particular problem. Once the population is identified, then what you want to do? You want to do the review of literature. You want to do the study design. That means which study design in epidemiology will apply in order to do this particular research. Then what you want to do? Once the design is there, then you want to find that how many of the studies that has happened previously based on this particular study, even in Kerala or in India or in Asia or in the world. Like that, you want to do the review of literature. Once the review of literature is complete, the next step is you want to write your own aims and objectives. Once the aims and objectives are fixed, what's the next step? You want to look into the sampling techniques. Which sampling technique you will apply? What is the sample size? What's the sample size you need by applying some sample size calculation formula? And then finally you will come to the tool for data collection. And then you will go for the collection of data. So these are the basic preliminary steps in any research. Again comes the point of this sampling. That means in biostatistics, we will use a term called generalization. So always when we do research, you may have noted that we will select a sample. We will select a sample and then we will, based on the study which we have done in that sample, we will generalize the result of that sample to that of the population. There you need the application, there you need the use of, there you need statistics. So in order to generalize the result of that sample to that of the population, you need statistics. There you will apply. That is the first step you need as a healthcare professional, you need statistics. The next step is, you may have heard the term called normal. What do you mean by a normal? Are you people normal? Yes, of course, you are all normal people only, isn't it? But in health or in medical field, this normal is having some other inference. As HB value, for example, if I am studying a variable called HB value, how will you calculate HB value? For what purpose you are having this HB value? In order to find whether the person is anemic or not. For that reason, you are collecting his or her blood and then sample of blood and then checking whether the HB value is within that normal limit. So if it is not in the normal limit, what we will tell the person is anemic or not. Person is anemic, isn't it? So what is that? So the normal value of that HB value is a physiological value. Understood? But we are telling about his pathological condition. That means the person is anemic or not. You understood? നിങ്ങൾക്ക് ഇംഗ്ലീഷ് ഫോളോ ചെയ്യാൻ പറ്റുന്നുണ്ടോ? ഞാൻ ഇടയ്ക്കിടയ്ക്ക് മലയാളത്തിൽ പറയാം, പക്ഷേ എപ്പോഴും ഞാൻ മലയാളത്തിൽ പറയത്തില്ല. Because you want to follow this. You people always, after nursing, you will always try for IELTS. There you will suffer if I talk you in Malayalam. Understood? So better for your future only I am telling you in English. But this I think I should tell you in Malayalam. എന്താണ് നമ്മൾ ഇവിടെ പറഞ്ഞ എന്താണ്? നോർമൽ എന്ന് പറഞ്ഞ വേർഡ് നമ്മൾ ഇനിയും നമ്മുടെ ലൈഫിൽ കേൾക്കാൻ പോകുന്ന വേർഡാണ്. If a person is coming with a BP of above 200 or maybe diastolic and systolic within the range of say 170, 250, we will tell that the person is having hypertension. But that value is what we call as the physiological value of BP is that diastolic and systolic value is a physiological value. But you are mentioning the stage, the pathological condition of that patient, telling that patient is hypertensive, or clinical condition of that patient, that the patient is hypertensive. Same thing in this case of HB value also. You are telling that the person's HB value is the normal range we will be knowing between 9 or say some 17 or 16. But if the patient is having his HB value as 7 or 6.5, what we will tell? The person is anemic. So we are pointing his pathological condition. Understood? So for that you need statistics. That means we want to correlate his physiological condition and pathological condition. Then next step we need statistics is to compare. If you want to find whether your batch is academically better performing than your senior batches, what we need to know? We need to know your second year marks. We will compare your second year mark with your previous batches, and we will tell that of course this batch is better than the previous batches in academic performances. Understood? So there you need statistics. Then in public health, now when we are always dealing with this pandemic situation, this COVID situation, the public health importance of the statistics is very, very relevant now. How? Because in planning, you may have seen that even our WHO itself has, WHO of course you may be knowing the full form of that, World Health Organization. WHO itself has revised the COVID definition itself several times. The COVID pandemic situation, they may have studied even after 6 months, still a lot of people are studying about COVID because it is still a mystery in health field. So you may have seen that how many times the WHO mentioned that mask will not be protective. Then they mentioned that mask is protective. Still the discussion is going on whether this mask is protective or not. So like that, several discussions are going on. There you need statistics for planning. There you need statistics for implementation. You need statistics for monitoring and evaluation. You need to know how many of them, or how, if they are using masks, how much they are protective against COVID. If you are not using, how many of them are getting this particular infection. All the impact of using this mask, or the impact of social distancing, impact of using sanitizer, everything we need to get only by using the method or statistical technique. Then of course the statistics is used in clinical medicine. That means treatment of choice. When a patient is there in front of a doctor, several questions will come to his mind. That which first once the diagnosis is there in front, after getting all the investigation result, or after getting the radiological result, or after getting the pathological result, the diagnosis is there in front of that doctor, but still several options will be there in his mind to give which treatment of choice to this patient. So there unknowingly he's applying statistics. Then even in the case of COVID, we have seen that first the WHO have mentioned that there is no need of any medicine. Then they mentioned that this hydroxychloroquine is comparatively good. And we have seen that even the American president has borrowed or asked us the malaria medicine, hydroxychloroquine, and then we have exported that to America. But later they found that there is no any as such effect of hydroxychloroquine on COVID patient. It is not improving their health condition, so they have withdrawn. Even America is using it, but some countries have been withdrawn it. And then even the America mentioned that remdesivir is more good compared to hydroxychloroquine. Now they are using remdesivir. How this remdesivir is effective than hydroxychloroquine? Because it will decrease the number of stay of the patient who is severely affected with COVID, like that. And then you may have seen in Kerala, in our area, this Ayush is giving a medicine called immunity booster. That medicine, they are telling that it is effectively applied or in some 107 patients in some Pandalam or some area, and it is good. Without any clinical trial, they are telling that it is good. So like that, without any human trial, we cannot apply a medicine. That you should know. You may have studied in pharmacology also. So like that, there are several treatment of choices there in front of us with respect to COVID. There you want to apply statistics. You cannot simply rely on that particular medicine and tell, this medicine is good. No, if once you studied statistics, you should know the effectiveness of that particular medicine in patient. How many of them have recovered from the COVID, or is it having a placebo effect on this patient? All this you should know. You should correlate. You will correlate with the effectiveness of that particular medicine among humans. So there is the importance of statistics in your life. And of course, after studying statistics, you will study the sensitivity, specificity. You will be able to understand the term called sensitivity and specificity. Even in our country, in Kerala itself, we can see that initially we have the test of COVID only RT-PCR test we were having. After that, what we have done, since this RT-PCR is not affordable, the cost of the RT-PCR initially was 4,500, but now it is changed to 2,800. Later, the government mentioned that you go to the test of rapid antibody test. After that, when this antibody test have been tested, since it is an antibody test, it will not give the effective COVID infection at that particular point of time. So the government again reframed that test and they changed to it is test rapid antigen test. Now it is the current test that is so popular is rapid antigen test. Understood. So you as a healthcare professional, you should also go to the current pandemic situation so that you can tell to your generation, next generation, that we have dealt with the situation like this. So you should also be updated with these techniques. So then only that question will come to your mind, that what is the need of you as a healthcare professional studying statistics.